Excellent. All right, guys. Hey, welcome back to Bert's Body's Basics. My name is Peter Burt. I teach here at Box Elder High School, and we are finishing up the skeletal system. Congratulations, you have made it. So this is the last standard, which is diseases and disorders. Now, once again, I'm going to teach you the anatomy of these guys, but some of you might have a lot more experiences with this than others. So like if one of your parents have a herniated disc, then you probably know a lot about it. So these are kind of fun to learn about, but not kind of fun to have. So here you go. Good luck. Here's the list of the things we need to know. So what I'm going to do is I'm just going to run through them all really quick and just kind of show you pictures of each one so you can kind of have a good job explaining this to somebody else. So let's go ahead and start with this one, herniated disc. To go back to old school, we have to go back to where we learned about the vertebrae. So if you remember, this is C7. There's 7 cervical vertebrae. This is my spinous process, right? This is my lamina, which comes in and connects them. This is my transverse process, which are the wings, say if you're thoracic vertebrae, where the ribs come in and anchor on. Okay, this is the actual cartilage pad. We talked about a cartilaginous joint right on top of the body. This is my vertebral foramen that has a spinal cord, and this is what a normal view is. So if we actually look at a herniated disc, okay, herniated disc goes by a lot. Some people say ruptured disc, some people say slip disc, some people said bulging disc. These are all the same thing. So what you guys need to know is that the disc is a jelly-filled donut. So you have your annulus on the outside, your fibrosis, like kind of like a thick ring, and then you have my favorite. Inside you have what's called the pulposa. Okay, that's your pulposa. So if you know what a pulp is the fleshy part of a fruit. So if you look in the center of these guys, this is a fleshy part. And in a herniation, what happens is this outer rim breaks a hole due to weakening or overuse or stretching, and all of a sudden the jelly, pulposa, starts to slip out. That's not necessarily what the pain is. The pain is you have nerves shooting out of here, and these nerves services different parts, and this is bulging and pushing on the nerve, on the spinal cord. And talk about painful. You've probably all had someone who's had a ruptured disc. Now, most people actually see this in the wrong way. Most people, when they think of a herniated disc, they think of like a disc on top of each other like this, and like the disc moves. That's not what a herniated disc is. A herniated disc is when this fluid leaks out and puts pressure. So there's lots of ways we can work on this. We can do bed rest, we can do exercise, we can try to lose weight. There's medications. You can do a laser surgery to try to burn some of this off. I mean, there's a lot. Just know that herniated discs is zero fun. Okay, next one, osteoarthritis. Now, once again, we know this. This is my epiphysis. This is my diaphysis. You guys should know all these words. This is my articular cartilage, okay? This is the meniscus, okay? I have ligaments that connect all these guys. This is my tibia. This is my fibula, okay? We haven't learned muscles yet, but that's your gastrocnemius right there on the back, okay? And this is my femur. This is a regular knee, right? But if we look, what is going on with this articular cartilage here? Well, that's what arthritis is. So arth is joint and itis is inflammation. Okay, so this is an inflammation of the joint. So I guess the only question you have is what's this one? Well, osteo refers to bone. So that's not necessarily bone arthritis. This is, I think, the most common arthritis on the planet. And it's basically wear and tear on the articular cartilage due to old age. So when you ever hear arthritis, think joint problem. But there's lots and lots of forms of arthritis. And osteoarthritis is just wear and tear due to old age. That joint's not going to move very well just because the articular cartilage has been a little beat up. Versus rheumatoid arthritis. Now, if you look at rheumatoid arthritis, okay, what we have here is we have the same kind of condition. My articular cartilage is starting to get destroyed. So you might not recognize the word rheumatoid arthritis, but you know you got arth and you know itis is inflammation in the joint. So when we get over here for rheum, okay, rheum means like a flux or forever changing. And toid is basically a resemblance. So this is resembling a change. And so what ends up happening with this rheumatoid arthritis is it gets started to get destroyed and it gets worse and worse and worse. So here you can see articular cartilage is pretty good and it gets lower and lower, and pretty soon and the joint starts to get destroyed, but then you pretty much soon start to get fusion, and all of a sudden this joint starts to cease to be, and where there is a joint, now there is bone fusion. So if you've ever seen rheumatoid arthritis, this is one of the telltale signs. The bones start to fuse together. Now you might ask what causes this. This is not necessarily wear and tear, because remember, wear and tear is osteoarthritis. This is caused by when our own body tissues start to degrade our own body tissues. There's a big name for that, and you guys better get used to this word because we're going to talk about it a lot in this class, and that is the word autoimmune disorder. Rheumatoid arthritis is an autoimmune disorder where our tissues start to destroy our own joint tissues, and then eventually the bones will have a tough time with mobility. Okay? Osteoporosis. Now, this is a huge one, especially as we age. Okay, I mean, it starts as early as 35 and works the rest of our life. So if we're looking at osteoarthritis, we know that we have spongy bone. Okay, you know you have spongy bone. You even know that there's red bone marrow that fills in these spongy spots. And you know that they undergo the big H, which is hematopoiesis. The problem is, as we get older, a lot of times calcium leaves faster than we can put it in. If that's the case, then we start to get pores in our bone, which is why they call this osteoporosis. Osteoporosis is basically when the bones begin to be brittle and start to lose their formation as we age. This happens to most of us as we get older, females especially after they hit menopause. It's something that we do have to consider that does make our bones weaker as we age, osteoporosis. Okay, let's talk about these guys now. These are the three major ones of the spine. Now, I know you guys all know scoliosis, right? Scoliosis is a pretty common one. So scoliosis is the word for scoliosis, okay, good, is a word for twisted. So you can see that this is, or crooked. You can see this is a crooked spine, more of a lateral being side to side. Now that's going to come in handy when we talk about the next two. Now kyphosis, kyph means like hump or hunch. So you guys might be more familiar with kyphosis as a hunchback. Now if you look, this is more a exaggerated curvature of these vertebrae, which should all have ribs. So this is a thoracic vertebrae curvature is kyphosis. Okay, you can call it hunchback if you want, but I'm going to call it an exaggerated thoracic curve. Where lordosis is very similar, but instead of thoracic and posterior, it's lumbar and anterior. So this is a curvature of the lumbar forward. So these both, lordosis and kyphosis, are abnormal curvatures of the spine, where scoliosis is also an abnormal curvature but more lateral and could be the whole spinal cord. Okay, so these are three that you just got to make sure you can tell apart on any diagram. Spina bifida. Once again, we got to get really good at these. You guys know you have your transverse processes, body. We have all these things. If you remember, this was called your lamina. Okay, and this was called your pedicle. So you have different parts of your vertebrae. But what happens if this doesn't fuse? Well, if these parts don't form, you got to remember your spinal cord's in here, and so are your nerves. So if this doesn't fuse, then all of a sudden your spinal cord can escape. Okay, whenever I have a malformation of a vertebrae where the nerves of the spinal cord or both are exposed, we call that one of the forms of spina bifida. Okay, so let me show you some pictures. So here's some picture of spina bifida right here. Okay, you can see that as we have this herniation. So as we have this herniation, you can see that if this vertebrae is not formed properly, man, I can have a bulge or a hernia, and that hernia could actually include nerves that are coming out of my spinal cord. Okay, or the quadriclina or something like that. So if we look, I mean, this is an artist rendition of it. But I thought that was a really, really good picture. That's how scary spina bifida can be. You don't get spina bifida as you're older. You're born with spina bifida. Your vertebrae are not fully formed. Now this next picture is a little scary because you're going to see the real deal. So I hope you guys are okay. That's what spina bifida looks like. Now it can be anywhere. It can be anywhere, but the most common places from what I've read is from L5 to S1. And it should make sense that L5 is actually one of the most common because it's one of the biggest vertebrae we have. So it probably makes sense that it takes the longest to actually suture and come together. So that's spina bifida. Kind of scary. Surgery imminent. Okay, spina bifida. All right, well that's it, y'all. So there is your quiz. So why don't you go ahead and take a time out. Go ahead and do these quizzes. These are just basic definitions, example of questions you're going to have. And I hope you guys enjoyed skeletal system. And now we're bouncing on to muscles. So answer keys coming up. And have a great day. See you on the flip side.